Let's face it, being in the hospital is no fun. But today, getting well is not the only challenge. We also have to figure out how to pay for it. People are always talking about the high cost of medical care, but what I never hear is, why did it really get so expensive? In 1960, the average American spent $146 a year on medical care. Compared to 2016, where that number is now $10,348. That's an increase of over 7,000%, 70 times higher. In that same time period, people's income only grew about 9 times. So the cost of medical care increased 8 times faster than our paychecks. This is a big, big problem. But why did the cost of medical care grow so much faster than our incomes? Did it go to doctors or nurses? Nope. How about insurance companies? Not really. Actually, the main culprit is your friend and mine, our own government. You can see that the biggest cost increases were due to administration and the cost of drugs. As you can see, from 1970 to 2009, the number of doctors grew slightly, while the number of administrators grew by over 3,000%. The growth in administrative costs was in response to more rules made by the government that had little or nothing to do with the care of patients. This has increased the cost of medical care by about 30%. Now, let's talk about drugs. Since 1960, the amount we spend on drugs in the United States has increased over 13,000%. You heard it right, 13,000%. This grew more than 14 times faster than our paychecks over that time. How could drug companies get away with that? Well, besides the fact that we use a ton of drugs, normally there is no way they could get away with this. They needed a partner that could get rid of competition and create monopolies for them. And who was that partner? Why, the United States FDA. That's who. Have you ever heard the word cronyism? Cronyism is when government regulators pick a friend to win and make everyone else lose. The FDA made monopolies out of drug companies in the USA, and those companies were only too happy to use the advantage of their good friends in the FDA. If you want an example of how cronyism can drive up prices, the EpiPen is a great one. Due to the actions of Congress and the FDA, the EpiPen became the only one like it allowed on the market in 2013. The makers of that item, now a monopoly, because our government excluded all the competition, lobbied Congress to require anyone who needs the life-saving drug to buy it from them. So while similar items can be found in Europe for $20, it now costs over $600 here. Without the FDA, it would be $20 here too. And all we know is that the FDA does not make drugs safer, since legal drugs kill and hurt many more people than illegal drugs each and every year. So let's say that the FDA and their cronyism adds another 20% or so to the cost of healthcare for no good reason. There is one more item that makes these prices skyrocket. There's no price competition. When you buy a car, you price shop. When you buy a computer, you price shop. But today, you do not have this luxury when it comes to healthcare. Imagine what happens when unnecessary regulations are ended, and there can be price competition too? Another 10% savings? So, government involvement tripled today's cost of medical care without improving the quality even 1%. If we got rid of that problem, your $600 per month health insurance bill would only be about $200 per month. For those of you that want tax-funded health care for all, the cost would also be 2/3 less in your tax bill. And you would have to only worry about one thing in your hospital stay: getting well.